Welcome to Paul's Heart. I'm Paul, author of the book Paul's Heart, Life as a Dad and a 35-year cancer survivor, available on Amazon. I wrote about my dad in my book and his experience with lung cancer. And I want to take a moment and talk about the early days of dealing with that diagnosis. It was discovered that he had a tumor located on his lung near his heart, and the plan was to undergo a partial lobectomy, basically removing half of his lung. At least that was the plan. He had issues in recovery. He wouldn't wake up. I don't know that that was necessarily a concern for my dad. He didn't really have a lot of problems sleeping, but okay, so it was a pretty rough surgery to go through, so it was no big deal. However, within a day or two, I noticed something wrong. Another relative had been asking me certain things about my dad's behavior that didn't seem to jive. My dad, not known for um, having a sense of humor, cracking jokes, and things like that, all of a sudden was making comments or looking for things and stuff that was like right under his nose and he should have seen, and he's acting like he couldn't see it. This was not my father's normal behavior. And so I came in to the hospital to visit him. Uh, I think it was like on the third day, and I stopped by the cafeteria to buy him some garbage food. Garbage food meaning better than what they brought him to the bed. He hadn't been eating, and I wanted him to eat. So I picked up some mozzarella sticks, something that I knew that he enjoyed. And as he sat there eating them, he made the comment, "How did they make these things so soft?" And I said, "What do you mean, Dad?" He goes, "How'd they make these carrots so soft?" And I said, "Dad, those are mozzarella sticks." And he's like, "No." He goes, "They're carrots." I said, "Dad, they're mozzarella sticks." And at that point, along with all the other examples, I felt something was wrong. Now, a neurologist, for whatever reason, had just been in to see my dad, hadn't made any note of any kind of behavior. If you talked to my dad, he seemed okay. But this not recognizing a mozzarella stick from a carrot was concerning. Like I said, my dad didn't make jokes like that. And there were other comments that he'd made that had grounds for concern. So I pulled the doctor into his room, and I explained to him what just happened. So the doctor pulled out a sheet of paper, laid it in front of my dad, and then drew a whole bunch of horizontal sticks, about 6 columns worth. And he asked my dad to draw a horizontal line through each, or a vertical line through each horizontal line. Gave my dad the pen. My dad went to work. Again, acting totally fine, following commands and doing what he was supposed to. Then he put the pen down, and the doctor said, "Are you finished?" And my dad said, "Yeah." And he goes, "Are you sure?" And my dad said, "Yeah." Well, when we looked at the paper, only half of the paper was completed. The entire right side was not marked. And the doctor went and slid the paper to my dad's left, and my dad could see that he left half the lines not with the vertical line through it. My dad's comment was, and he proceeded to finish the assignment. The doctor immediately ordered an MRI of his brain and had discovered that my dad had two major strokes in the front of his brain. When that happened, we don't know. It could have happened during the recovery, but the fact that it wasn't picked up until my dad's behavior got noticed. So the point of telling you this story is stroke awareness. Because once they knew that something was wrong and they could get him diagnosed with it, they could treat him. And when it comes to strokes, timing is critical. So, the easiest way to be aware of strokes is to remember this simple, timely, uh, I think they call it an anagram: be fast, B, balance. Okay? Somebody loses their balance suddenly, or coordination. Their eyes, any sudden vision changes like blurry or loss of vision. Face, a lot of times the face, one side will drop or go numb. You can ask the person to smile. A, for arms, weakness or numbness in one arm, you ask the person to raise both arms. Speech, S, if the speech gets slurred, difficulty speaking, or inability to understand speech. And of course, time, T, be fast. Okay? If any of those signs are visible to you, you call 911 immediately, 911 immediately. Timing makes all the difference to administer the medicine to help with that. Now, there are risk factors. Blood pressure, high blood pressure. I talked about stress in another video previously. That high blood pressure is the leading cause of strokes. Okay, health conditions such as diabetes, heart disease, AFib, a previous stroke, something they call a TIA. They're all health conditions that can lead to strokes. Lifestyle, of course, smoking. It's the biggest one. Obesity, poor diet. Of course, that means like high intake of red meat. All these things increase the risk of strokes. And, you can prevent them, with a healthy diet: fruits, vegetables, exercising regularly. And I'm not talking about going gonzo in a gym. Simple walks help, especially when it comes to managing the blood pressure. But I'm not going to get all scientific on you how a stroke, you know, snowballs and causes more problems. But just know that every minute makes a difference without the proper blood flow to the brain. Okay? The quickest response you can get is ultimately what's going to lead to the best chance of recovery with little or no side effects. Anyway, just remember those two words: be fast. Balance, eyes, face, arms, speech, and time. Okay? Be fast. That's how you be aware of strokes. Okay, hopefully that helps. Until next time, this is Paul's Heart.